Welcome back. In this segment we're going to cover group leadership and talk about some of the concepts and techniques that an effective group leader should have. As group leadership really requires a bit of a combination between some specific personal qualities that we'll also discuss, as well as professional practices. Okay, just to start off with, a couple of things that an effective group leader should be able to do is, first of all, adjust their professional styles to the particular needs of the different types of groups. So the types of groups, the 5 different types of groups we discussed in one of the previous sections. You need to also model group appropriate behavior. And in that, you need to remember that as a counselor, you are the primary role model and example to other group members. So therefore, you need to exhibit the same kind of behavior and attitudes that you are promoting or expecting from other group members. You need to be able to resolve issues within ethical dimensions. So ensure that you are well knowledgeable and capable in ethical responsibilities and competencies, and you are able to spot any dilemmas and resolve them. You need to be able to manage your own emotional contagion, so always ensure that you're not becoming emotionally affected by what's going on in group, as that will affect your rationality and decision making and your overall effectiveness. Work only within modalities for which you are trained. If you are trained in a 12-step modality, you cannot simply go over and work in a smart recovery modality. You would need to receive the adequate training. Try to prevent the development of rigid roles in group. You don't want to play a rigid kind of role in group. You need to be flexible. You need to be able to adapt and work in whatever kind of scenario or situation is thrown at you. Try to avoid acting in different roles inside of group to outside of the group. So you cannot play a leader type role who is very respectful, considerate, and so on inside of group, and then outside of the group you're just one of the guys and you are cracking rude jokes or being disrespectful and so on. You need to be able to motivate clients in substance abuse treatment. So obviously, the first prize is always for clients to come in willing, but sometimes they need a bit of motivation. You need to be able to try and talk them into or try and motivate them into seeking help for their substance abuse, and maybe motivate them by giving some of the possible outcomes or positive outcomes that treatment may provide. You need to ensure the emotional safety of the group. You need to sometimes protect group members who are being attacked by other members. Ensuring the safety in the group is your responsibility. As in the next one, maintain a safe therapeutic setting. This sometimes involves the deflecting of defensive behavior, but without shaming the offender, and also recognizing and countering the resumption of substance use. So you need to be able to spot the difference if somebody's been attending groups clean and okay, to then suddenly their behavior changing dramatically and their attitude changing, as well as exhibiting some of the symptoms of substance use. You also need to be able to protect the physical boundaries according to the group agreement. So whatever the group has decided is the agreeable terms for membership is also your responsibility to enforce. You need to curtail emotion when it becomes too intense for other group members to tolerate. So if it gets really out of hand, that you are able to then deflect or move the situation or onto a different topic possibly, or in worst case scenario even be able to end the group. You need to also lastly stimulate communication among group members. You need to be able to pick up when certain group members are isolating, be able to prompt them or maybe question them and just give them a little bit of a nudge into participating and starting to communicate. The first essential quality of a group leader is consistency. Consistency we've discussed before. A client should find the counselor almost predictable in how they are from one group to the next. This consistency helps to create an environment of safety and security to the client. Some examples of consistency would be seating arrangements. Try to ensure that you sit in the same position from one group to the next. Also, how you respond to certain behaviors. So you cannot confront certain behaviors in one group and then you're condoning those same behaviors in another group. You should also be consistent in how you set boundaries. Those boundaries being the time that the group starts and ends, or the standards of comportment, as well as the ground rules for speaking in the group. Now, the type and setting of the group should help determine appropriate dress, but whatever the counselor decides to wear should pretty much be predictable from one group to the next. So try not to come to one group wearing a shirt and tie and then attending another group in blue jeans. Active listening is the next essential quality. Excellent listening skills are the keystone of any kind of effective therapy. So we pay very close attention to both verbal and non-verbal cues during the discussion, and this is becoming a little more difficult as we're often dealing with a few group members rather than just a one-on-one. So good group leaders need to pay attention to the context and frame of reference from which the meanings in the discussion are coming. Is it pertaining to the here and now of what's occurring in the group, or are there in their history of that specific client? Another additional thing is also try and pay attention to what's going on for other clients during the discussion. When they don't know that you're looking at them, the way that they react or their facial expressions and body language can also give some insights into what's going on for them personally. Next is a firm identity. A good group leader should have a firm sense of their own identity. They should recognize their own limitations, capacities, and tendencies in group, as well as how their defenses might play out in the group. Group leaders who cannot control their emotional responses can do significant harm, especially if they're unable or unwilling to admit their mistakes and apologize for them. So good group leaders should be emotionally healthy and well in tune with their own personal problems or issues, and they should be able to set boundaries between their own personal issues and group issues. The next essential quality is confidence. A good group leader should exude a certain amount of confidence, but not a confidence in that they're going to solve all the group's problems, as that would be unrealistic, as most groups are really an unpredictable unfolding of events. What you can be confident in is your knowledge, your skills, your experience, as well as your intention to help. Next up is integrity, which is extremely important. Due to the nature of some of the discussions you can have in a group setting, especially process type groups, ethical issues can arise. So it's important that leaders are well familiarized with the policies and procedures of their institution, as well as the relevant laws and regulations in your area or district. Usually an institution will have their own policies and procedures manual that you would need to be familiar with. And also leaders should have a firm grounding in their own internalized standards of conduct, as well as be able to maintain the ethical parameters of their profession in groups. Next is trust, and group leaders should be able to trust other members in the group. Without this capacity, it becomes impossible to accomplish the key focus of the group, which is a restoration of the other group members' faith and trust in themselves, as well as their fellow human being. Now, in addiction, some counselors might argue this and feel that they need to be guarded in groups, as addicts can be quite untrustworthy and dishonest and divisive and manipulative. Now, the problem with that is that if you go in with an almost cynical attitude and a distrustful attitude, you'll make the job very hard for yourself. You need to remember that a group member being dishonest or being insincere can only really jeopardize their own recoveries and hurt them. It can't really hurt you at the end of the day. So we need to try and approach other group members with an attitude of giving them the benefit of the doubt and giving them that trust, because you really don't know whether they're being sincere or not. Next is humor, and humor is definitely quite an important part of your therapeutic approach, because humor can soften things, it can sometimes lighten the mood, but only when necessary. We need to know how to use humor appropriately and at the right moment. You don't want to use humor when there's a serious discussion going on, when somebody's really opening up about some serious feelings. Being humorous at that point can be quite offensive and embarrassing for the client themselves. And we also never make humor at somebody's expense in the group, as that can also break down their trust and their respect for you as a group leader. Next up is empathy, and we've already covered this in quite a bit of detail in this course, but the main thing is just really to be aware of the distinction between the client's feelings and your own, and to ensure that you're not being overly empathetic and that you're well aware of the difference between empathy and sympathy. There is some more information in the manual on empathy from various different publications that you can also have a look through. Last of these is spontaneity, and in this, group leaders need to be creative and flexible. Groups are very unpredictable, as well as any counseling really, and so we need to be able to shift and move with the mood or the atmosphere of the group. So if the group has got a really serious atmosphere, we don't want to be going in there very light-hearted and humorous, as that can jeopardize things. And same on the other hand is if it's a very light mood in the group and you're going in very serious, you can dampen things. So we sometimes need to know when to add a little humor to lighten things up, or when to pause for effect if a client is experiencing some emotions that you want them to stay with, or even how to diffuse what can sometimes be a very intense or heated situation.